UltraDrape, ultrasound-guided peripheral intravenous sterile barrier and securement. Instructions for use. Begin the procedure with an ultrasound assessment, selecting a vein which best meets size and depth requirements. A catheter should not take up more than 45% of the vein. Mark the vein you intend to cannulate and prepare your catheter and supplies. Prepare for your aseptic technique and change gloves. Thoroughly disinfect the skin on and around the area selected for insertion. An alcohol-based skin disinfectant is recommended to provide rapid drying of the skin. Hold the UltraDrape dressing with the blue tab facing you. Remove the white paper indicated as number 1 and discard. Center the dressing above your mark. Place and adhere the dressing rear half on the skin, the part without the split. The lower half of the dressing with the split will stand upright and away from the skin and the target insertion site. Apply ultrasound gel on top of the dressing portion that's adherent to the skin. This is the non-sterile portion of the dressing. Increase the gain on the ultrasound unit approximately 10% prior to scanning through the UltraDrape. Position the probe close to the upright barrier portion to image the vein and needle insertion. Hold the barrier with your thumb if necessary. Insert the intravenous catheter using ultrasound to guide the needle and catheter into the vein. Achieve your blood return and advance the catheter into the vein, completing the extension tubing attachment, flushing, and securement method as needed. Once the placement of the intravenous catheter is confirmed by flushing, grasp the blue tab on the rear portion of the dressing, indicated as number 2. Pull away from the dressing and remove the top layer where the gel was placed. Discard the film cover and the gel. No further cleanup is necessary. Now grasp the tab on the split portion of the dressing and remove the film cover by pulling away from the insertion site while stabilizing the adherent side of the dressing. Set the film cover aside and note the location of the adhesive strips for later use. Press the dressing over the IV and tubing. Use the split section to cross under the tubing and adhere to the skin. The additional adhesive strips can be used over the catheter hub and tubing. Document the date of insertion on the outer dressing and in the patient medical record. You have now completed the insertion procedure using the UltraDrape sterile barrier and securement for ultrasound-guided peripheral intravenous catheter placement.